back in 2006.
And then you found a lump in your breast, 7 years after that?
Yes. It was last 2 years ago now.
So was that breast cancer or was that skin?
No, it was melanoma.
Right. So that was seriously bad news.
Yes, it was. I was told that it was stage 4 cancer, which means it's spread to your internal organs.
And your treatment at that time was what?
I hadn't at that time had any previous drug treatment, so I was put on the ipilimumab Nivo trial.
And how was that sold to you at the time?
I was told it was a trial, and they, if you ask any questions, they can only do their best to answer them because there's no previous knowledge. But I had a dedicated trials nurse, so if I had any concerns or issues, I could ring her. And Dr. Larkin is wonderful, very supportive, and what he wanted was for me to, I was well at the time, it was only, the melanoma wasn't actually giving me any symptoms, so he was hoping to keep me well and allow me to carry on with my usual lifestyle.
And what was the impact of the drugs on you? Were there side effects?
Yes, I had severe side effects, but they were treated, which meant then I had to come off the trial. But only off the medication. They still monitored me, and I was tumour-free for over a year.
Okay, so it's interesting that in the coverage you had today, we shouldn't forget that there are significant side effects to this new kind of miracle treatment for cancer. It's a bit like chemotherapy in that respect.
This was a trial, and it was a combination of 2 drugs, which were extremely powerful. It's a blind trial, so you don't know what you're getting. But from what I understand, if you were only having the Nivo one, the side effects were less. But the hard thing is, they don't know who it'll work for and who it won't. It's a bit of a lottery at the moment. There's no way of knowing whether you'll respond to it, and not everybody does.
And since your treatment, though it cleared up that tumour, a second one has emerged. So,
yeah, and now I've got a third one.
Right, so you'd hope that those drugs would work again on dealing with those?
I hope so. I'm seeing Dr. Larkin in next week to discuss where we go now.
And you obviously would see the potential side effects again there, having been through them before. You know what you're in for.
I don't think he'd give me the combination again. I think it's a bit too powerful for me. Right. But there are some other new drugs coming along now that possibly I would be happy to give a go to.
So what does it feel like to be at the forefront of medical science?
Well, I'm here. If it hadn't been for that, maybe I wouldn't be here. So I count my blessings. So I'm really grateful to all the people who do all the research, and for those who cared for me. It's mentally quite challenging. So it isn't only about the drugs. I've been really lucky. I have a wonderful GP. I've been supported by my local hospice and also Melanoma UK. If it wasn't for Melanoma UK, I wouldn't be where I am today because Gillian is the one who referred me to James Larkin at the Marsden.
Okay, well, I hope you get some good news and the treatment goes well with the other ones.
Thank you very much.
That is Vicky Brown, who's been helped no end by this combination of these 2 drugs being hailed as a great breakthrough in the treatment of melanoma, amongst other things. Gillian Nuttall is founder of Melanoma UK, who got lovingly name-checked by Vicky there. Gillian, so brilliant. You've done astounding work in your field, but you've been helped no end by the people who spend hours and days and months looking into microscopes and coming up with these treatments.
Of course. course. Good morning. We do forget sometimes, don't we? That when you just see this headline, a headline-grabbing piece of news, and you go, "Oh, that's great," and you really do forget these people who work on the benches and they're doing this work. And I, along with other melanoma patients, are very, very, very grateful to their great knowledge. They're astonishing people.
So I just wonder about the number of people with melanomas now who've had that diagnosis, and I mean their ears must prick up at seeing this great news we're having today, but it's going to be frustrating because presumably it's some way down the pipeline before it's universally available, and when your life's in danger, that's very difficult to swallow.
Yes, that's always the case with any new treatments. It's so frustrating because you kind of look and think, oh my goodness, if only I could get my hands on that kind of, first thing in the morning. But clearly there's several more hoops to jump through with NICE, etc., and approvals before this will be taken. Obviously these results are coming from trials. So, harnessing the immune system is playing such an important role in research now, and it clearly is another very significant step forward in melanoma. But there is, there are some further hoops to jump through, and unfortunately for patients.
So at the moment, if you are to get a diagnosis of melanoma, what are your options if you're being conventionally treated?
Okay, so if melanoma is caught early enough, it is one of the most treatable cancers, which is good news. And the problems lie when it becomes advanced, as in Vicky's case, where she's quite a way down the line. So years ago, there used to be very limited options for melanoma patients. It was a standard chemotherapy, which would have a very, very poor response indeed, and patients were basically given death sentence back in those days when I came into the melanoma arena 7-8 years ago. But now you obviously have to trust your team that you have, and usually you start off with surgery to remove it, and then further test to see how advanced you are, because these treatments that we're talking about today are only suitable for melanoma patients with very advanced disease. So if you're an early melanoma patient, you wouldn't be appropriate for one of these treatments anyway.
So it's well worth going through the two things we always say in melanomas. Firstly, how to avoid getting it, which is to keep out of direct sun and wear the highest sunblock you can get your hands on. Mm-hmm. That's about right, isn't it?
Yeah, I mean, not everybody who's diagnosed with melanoma has a history of sunburn, although it is kind of classical symptoms, and we all say, keep out of the sun. But there are a number of patients who've never sunbathed and who haven't used sunbeds, and there may be something in their genetic makeup that's led to this. So, but yes, obviously, sunbeds using good sun protection is great advice.
And then if you have an irregular mole that it's raised, and I think it's irregular around the edges, and it might be that it might bleed a little bit, these are the things to look out for.
Absolutely, yes. I mean, the thing is, our whole body is covered in skin, and we just as we would check breasts, testicles, blood in your stools, that kind of thing. You should make sure you keep a great check on your skin as well, because you know your skin better than anybody else. And if you see something that's not quite right, then get it checked out. We need to be clear on that to make sure we do take any suspicious lesion mark on our skin straight to the GP, and if it needs referring to dermatology, then so be it.
Okay, Gillian Nuttall, thank you very much.
You're
from
welcome.
Melanoma UK. Let's speak to David Taylor, Professor Emeritus of Pharmaceutical and Public Health Policy at University